emergency I'm an emergency medicine physician. I'm currently working at the Milford Regional Medical Center. I actually started volunteering with the Worcester Refugee Assistance Project before I applied to medical school at UMass because my parents are refugees from Vietnam. So this population is very near and dear to my heart. I watched my parents and my family grow up in America, as refugees. So I understood their struggles. And I wanted to reach out to populations that had similar struggles to see if I could help in any way. And so I think 12 years later now, I'm still volunteering with them, and I'll be talking more about our recent work. So today I'll be talking about caring for Afghan refugees and understanding the barriers amidst a pandemic. So I would like to start this talk off with a famous quote out of a poem called Home, written by Warsan Shire. No one leaves home unless home is the mouth of a shark. I'm going to repeat that because it's so strong. No one leaves home unless home is the mouth of a shark. This poem, it accurately depicts the constant struggles of a life as a refugee. And it reminds us that people fleeing from war and persecution are being forced to leave their homes for safety and for opportunity for their families. Theoretically, it sounds great, right? Being able to experience freedom from persecution, but that freedom comes with a huge price tag, leaving their families, friends, communities, needing to learn a new language, a new culture, finding a new job, figuring out a new means of transportation, providing for your family in a new country, learning the new healthcare system, and I think worst of all, being perceived as less than or dirty immigrants or people who are sucking up resources in your country. So if you have time, I would urge you can just look it up on YouTube. There's actually a reading from Warsan of this poem. It's amazing. So Worcester Refugee Assistance Project, or WRAP for short, is a nonprofit 501c3 organization. It was created in 2009 by Meredith Walsh, who at the time was an RN attending the UMass Graduate School of Nursing at UMass, along with a group of local volunteers from a church who came together in response to the wave of refugees that settled in Worcester in 2009. And so we are a completely volunteer-based organization made up of undergraduate students in the local Worcester area, UMass medical students, UMass physicians, undergraduate professors, and local community members. Our mission is, we're a network of individuals committed to assisting refugees and resettled migrants achieve sustainable self-reliance. And we do that through mentoring, advocacy, and through educational assistance. We are an independent nonprofit organization, but we work very collaboratively to complement and augment the efforts of other organizations and individuals assisting refugees and resettled migrants in the Worcester area. So we, as I had mentioned before, began as a nonprofit organization aimed at supporting Burmese refugees back in 2009. But with the recent influx of Afghan refugees, we've expanded our mission to help all refugees and migrants in the local Worcester area. So from 2009, fast forward now to 2021, President Biden ordered the U.S. military to leave Afghanistan in August of 2021 after 20 long years of war, leading to Operation Allies Welcome. Unfortunately, the Taliban has taken over the government almost immediately since then. So President Biden arranged emergency evacuation and transportation via airplanes to bring vulnerable Afghans to the U.S. And that's including all Afghans who served in the U.S. military. So on August 29th, 2021, President Biden directed the U.S. Department of Homeland Security to lead the efforts across the federal government to support vulnerable Afghans, including those who worked alongside the U.S. in Afghanistan for the past 2 decades, so that they could safely resettle in the U.S. So Afghans have been given a parolee status, and that's not an immigration status. It's actually different from a refugee status. When you're granted a parolee position, it justifies your ability to enter the US because there's an urgent humanitarian reason. So initially, there was a lot of confusion about whether the Afghan parolees would be able to get any of the refugee resettlement benefits, and they actually did approve in the U.S. to grant the Afghan parolees all the benefits of a refugee in the U.S., and that's including temporary assistance for needy families and SNAP benefits, which is a supplemental nutritional assistance program. So let's just go quickly over the process of an Afghan parolee resettlement in the US. So step one, there's a screening and vetting process where fingerprints, photos, other biometric data are collected for every single Afghan before they're cleared to travel to the US. And for applicants who are then approved for admission to the US, the next steps include assignment to a resettlement agency in the US, completion of a case documentation, and then travel arrangements. So number three, once they arrive to the US, they have initial processing at a pre-designated military base where they receive full medical screening, a variety of services prior to moving to their next destination. And then the families and individuals are relocated to the states where they're assigned to the specific refugee resettlement agency. And so these resettlement agencies are responsible for providing housing, food, SNAP benefits, cash assistance, mass health insurance, and helping families apply for legal documentation for the first 6 months. So the two biggest organizations in Massachusetts are REAC and Accentria. And then beyond reception and placement, there are various nonprofit organizations such as RAP, United Way, WARM, Ansar Worcester that all came together to assist the Afghan refugees further with resettlement. So Worcester Together was a citywide partnership that was actually initially established to support the region's COVID-19 response, relief, and recovery efforts. And as soon as Worcester learned that they were going to be receiving up to 2,000 Afghan refugees, the group actually created weekly Zoom meetings, invited all of the local nonprofit organizations that were assisting refugees in Worcester in an effort to really help these Afghans resettle in Worcester. As you can see, sort of on the left in the middle, there's Accentria Care Alliance and Refugee and Immigrant Assistance Center. Those are the two refugee resettlement agencies in Massachusetts that really were sort of like helping us run the show. And so we were able to get Congressman James McGovern, Senator Edward Markey, Senator Harriet Chandler on these Zoom calls. And with their support, we were able to actually raise a lot of our concerns at the state and federal level. So it was a huge success, in my opinion. So in order to start organizing and tracking all the Afghans who resettled in Worcester, we started this large spreadsheet and we shared it among all the local community organizations so that we could really figure out, what family needs who has health insurance, who doesn't, what language do they speak, do the families have SNAP benefits, have the kids been enrolled in, schools. So there was a huge to-do list for greater than 500 people that showed up in October of 2021. So we all sort of would come together and say, okay, well, this group will work on this group will help with this. So we'll talk a little bit more about it in the next few slides. So housing. So the biggest issue initially was where were we going to house 500 Afghan refugees that were quickly arriving every day in the beginning of October 2021. So the refugee resettlement agencies started housing the Afghans in the Quality Inn in Worcester, while they started searching for apartments and more permanent housing for the individuals and families. As you can imagine, living in close quarters during the pandemic was a source of stress and anxiety for all of us involved. And all of the community organizations working with the Afghan refugees would encourage masks when the different families were spending time together, which of course was difficult to enforce, especially with the younger children who would sort of play with one another in the hallways. And so the way it worked, if you see in this photo, on the bottom, the two photos on the bottom, the larger families would be placed in these bigger hotel rooms with the couch, table, and a kitchen available. And then sort of up in the right upper corner, the single men or individuals were placed in a room together in the double bedrooms. None of the families or individuals had any kitchen supplies for their hotel room. So we actually came together, RAP came together to create a fundraiser to collect the necessary items. So this is sort of a little flyer that we created at RAP, and we teamed up with some of the residency programs at UMass, including the emergency medicine program and the family medicine and internal medicine program, to collect kitchen and household items, food. And in just a few weeks, that's my garage right there, we received over hundreds of donations that the members, we would bring to the members of another organization called Ansar of Worcester, and they would help pass out all of the items to those in the hotels. And some of these items are sort of the 3 items that they really wanted: a pressure cooker, a thermal coffee holder, and then sort of like a nonstick soft touch to make the breads. And so most of the Afghan refugees were assigned to 2 community health centers in Worcester, the Edward M. Kennedy Health Center and then the Family Health Center. So the initial appointments included initial health assessments that were required by the Department of Public Health for newly arrived refugees. And the community health centers really helped the families apply for mass health insurance. The tough part was when somebody needed to go for a sick visit, we really didn't have that much transportation available. All we had were volunteers, and if we could get the people to their appointments, great. If not, we had to sort of call a cab, and somebody would have to figure out the money for them. And as you can imagine, with such a large influx of new patients, the 2 community centers were struggling to book appointments for everyone in a timely fashion, and even getting same-day sick appointments for them was way tougher. So a lot of people were calling ambulances to go to the ER for care. So this, started to pose a little bit of strain on the ER. We were seeing a lot more Afghan refugees there for non-emergent care, which is okay. That happens, and we just sort of figured it out. So the language barrier was a huge problem initially because volunteers and providers were having a lot of difficulty figuring out which language the Afghans spoke. There are actually 3 main languages that they speak: Pashto, Dari, and Farsi. And the tough part is that they couldn't even tell us, which language in English, they couldn't tell us what language they spoke. So they'd often just be assigned the incorrect language if they showed up to the ER, if they showed up somewhere, to a doctor's appointment. And so once they'd get the interpreter up on the iPad, and that takes like 10 minutes, then it's the wrong language, and we're sitting there trying to figure out what language they speak. So these patients would sit in the ER for prolonged periods of time. And as you can imagine, that poses a huge barrier to their care. In our ER, specifically at UMass, I no longer work there, but at UMass, one of the doctors, Dr. Payal Modi, actually took it upon herself to reach out to the interpreter services to see if they could just provide 24/7 access to the 3 main languages, at least, in the first year, while we were seeing a lot more of the Afghan refugees there. So because of her, we were actually able to expedite interpreter services for those languages, which greatly helped out those patients. And along with that, sort of if anyone had an issue and couldn't figure out what language they spoke to, they could reach out to me through the medical records, and I would be able to go search on the spreadsheet what language they spoke, and then would come back and be able to tell them, what language they speak, what type of insurance, who their primary care doctor is. So I was able to actually also arrange a follow-up visit back to their primary care physician at either Edward M. Kennedy or Family Health Center. So, what we did in Worcester, I think, is an extremely great model. And I know that a lot of the Boston hospitals have trouble with this. And I've spoken to sort of a few people who've worked with more of the Haitian refugees recently, and they're not getting the sort of the attention and care that the Afghan refugees received, which is unfortunate. So the medical needs, a lot of people came with medical needs, and we initially came up with a plan to purchase over-the-counter medications, including Tylenol, ibuprofen, Tums, to just bring directly to the Afghan refugees at the hotel. So as the OnSAR was passing out food, I sort of would sit on the side and ask like if anyone had, some type of medical need that, pain somewhere, I would be able to give them a small bag of Tylenol, write out how much Tylenol, how much ibuprofen that they could take while they're waiting to get their visits with their primary care doctors. So then things got a little bit tougher. In January 2022, we learned that a few people tested positive for COVID at the Quality Inn. And knowing that the families and individuals were living in such close quarters, we decided to carry out door-to-door COVID-19 testing at the Quality Inn to help prevent the spread of COVID-19 among an already disadvantaged group of people who didn't necessarily have PCPs yet or access to healthcare. So I went to UMass. I just gathered a bunch of N95 masks, gloves, gowns, other supplies. We picked up boxes of COVID tests from the National Guard to prepare. And we got a group of UMass medical students and residents together to test close to 500 people for COVID-19. So once we did that, anyone who tested positive for COVID-19 was restricted to their hotel room for 10 days, and food was delivered to their door each night. And, they were told, you need to quarantine to help us prevent the spread. And I think that was a really great effort. Only a few sort of hotel rooms and families had to quarantine. And after that, we didn't really hear much else. So I think that was a great effort. Providing food was a huge feat to take on initially, as the Afghan refugees are Muslim. So we had to be mindful of the food that we were offering. Luckily, Ansar of Worcester is a local nonprofit organization in Worcester that focuses on helping refugees and are particularly knowledgeable in the Muslim traditions, holidays, foods. So Mona Ives, who was the president of Ansar at the time, she's extremely helpful in teaching all of our organizations, all the nonprofit organizations who were involved, the importance of only providing halal foods to Afghan refugees. And so Ansar was particularly helpful in understanding the times it was appropriate to go to the hotels, because you can't just come knocking on the door at 12 p.m. because that, there are 5 praying times throughout the day. And if you just show up, they can't just necessarily open the door for you because they might be praying. And so RAP would collect donated items from several community members. We went to the restaurant depot, purchased large batches of vegetables, halal meats, and we delivered them to Ansar. And you can see a picture here. These are boxes of vegetables that we collected and brought to Ansar so that they could prepare the meal, split up the groceries to provide for families that had kitchens in the Quality Inn. So it was a really, really great effort. And we fed a great amount of people in those hotels for weeks and weeks and weeks. Apartment setup. So as REAC and Accentria, the refugee resettlement agencies were starting to find apartments for the families. There was another local nonprofit organization called the Welcoming Alliance for Refugee Ministry called WARM, who worked closely with the Fresh Start Furniture Bank to collect furniture items for homes and to set up these apartments. So once they collected all the items that they needed for each apartment, they set up a day for volunteers to sign up for cleaning in the morning, and then volunteers to move all the furniture in the homes, make the beds, and provide a welcome fruit basket. So here is a photo of one of the homes that we helped to set up for 2 families. We, in the living room there, we set up a fruit basket for them, and for the kids' beds, we put, some teddy bears to sort of make it a little bit more homey. And it was really great to see at the end of the day, the families' reactions when they came in to see their new homes. So that was nice. And I know that a lot of these families appreciated it and just couldn't wait to get out of those really cramped quarters in the hotel. Several women were pregnant and expecting children in the first few months after arriving to the US. So I reached out to the Marie's Mission, which is a diaper outreach program in Worcester, to collect hundreds of diapers for several families. Many women also needed pregnancy testing, had no access to tests. They didn't have a doctor yet. So we were buying pregnancy tests and sort of coming to the hotels and saying, here, pee on this stick, and we'd all find out together. So that was interesting. So once we knew they were pregnant, we'd get them, urgently to follow up with a primary care physician at one of the community health centers. And we also helped several children enroll into the public school system in Worcester. So enrollment was quite a process. You had to schedule an appointment with the Parent Information Center, take the children with their parents to the appointment where the child would be assessed to see what grade they'd be placed in. And then based on the location of their new homes, they'd be placed in the school closest to their homes. So that was a lot of driving back and forth, families and children to the Parent Information Center to get kids enrolled. And that was a lot of work, but definitely worth it to get these kids into school, because they were just sitting in the hotels and, begging. They were actually begging to go to school. They wanted to learn. They wanted to be in school. So that was great. And so what do we do? This is just a list. These are just pictures of flyers, anything and everything. RAP provides ESL classes. We do citizenship applications, educational support. We give material donations if necessary. And here's, we're assisting people with food security, enrolling in school, volunteering to set up apartments, providing ESL classes for the Afghans and other refugees, mentorship for the teen refugees. There's tutoring classes available. There are always mentors in RAP who can help with federal aid application assistance. Monday night at RAP, there from 5:30 to 7:30, there is a Monday night education session where all the kids that are in school are invited to RAP to sort of learn a new topic, do their homework together with sort of other people that, that they can feel connected to, because they're all split up now in different schools. So RAP, getting them together at RAP is a way to really bring them to a place where they feel safe, where they can feel like these are people, these are kids just like me. And so that they don't have to feel so isolated at home. And so I think the biggest barrier for that is the transportation, getting the kids from their homes all over Worcester to RAP. That we've recently acquired enough funds to be able to get a bus and pay for a bus to pick up all the kids for the after school program, which is something that we have never been able to do before. So that was awesome. We assist people at their medical appointments if they need help, if we feel like something is falling through the cracks and we really should be there to advocate for them, to get the interpreter up, to really tell the doctor what specifically they're, looking for. We help with driver's license applications, US citizenship applications, you name it, we do it. And then this is just a picture of some of the fun things that we do in the community. We have food fairs. We sell Burmese food. Recently, some of the Afghan families have also volunteered to sell some of their foods to raise money for RAP. We hold Halloween parties for the kids. We take them ice skating every year, a beach trip every year, a lake trip, a camping trip with the kids where they get to go kayaking on the lake. And we always have a holiday party to pass out gifts. So I know the talk is a little bit short. Does anyone have any questions?